Abrazo. I'm hoping my clicker is going to make it to the laptop. A lot of changes to Abrazo since many of you have. I know some of you have worked there in the past. A lot of changes since you've probably been there since. Used to be a Phoenix Baptist Hospital. We've gone through a significant renaming, rebranding over the last year, 9 months to a year. The new name of the hospital is Abrazo Central Campus. We are part of, and I'll get into this a little bit more detail here in a minute, but we are part of Abrazo Community Health Network, which is a larger network of hospitals here in the Valley, as well as in Tucson and the rest of the country, to be quite honest with you. And so as part of that, to develop a more cohesive organization, we decided to rebrand the system, come up with all new names that represent more of where we're located in Phoenix, the communities that we serve, and so therefore we came up with Abrazo Central. So a little bit about, so you also notice we have a whole new look and feel of the organization, new logos, new phrases, new cap phrases, whatever they're called. Embracing care, embracing tomorrow. You may actually see new commercials. We have quite a few new commercials on TV that are actually airing right now on all the major networks. They're on Food Network, they're on ESPN, they're on Home and Garden, so they're all over the place. You'll also see new billboards, new advertisements in the newspapers. So for the first time that really any of us have been part of Abrazo, we are starting to brand and advertise who we are. And so if you don't know that, since you were there, probably since, would you say 2006 is when you?
When I retired, yeah, but I was there for 20 years.
So just to give you an idea, we're at 15. Since that time, we have been through 15 CEOs. Okay.
No, I knew.
Yep. So in 10 years, Abrazo Central has been through 15 different CEOs. The new leadership team, myself, Dan Jones, our CEO, Paul Hemel, our Chief Financial Officer, we've all been there now for 2+ years. And so we're the longest tenured leadership team in roughly 10 years. So we are excited to be part of the organization and really, at this point, we've gotten the organization to, we've kind of redeveloped it, I would say, and I'll go through some of those, some of the initiatives here in a minute. But now that we are stable, the leadership is stable, we're now getting ready we're kicking off more of a community involvement. And that's why we're here. We're working with Shannon on some various things. We had an event last Friday that we did some things for the kids. We're going to be part of the bike rodeo. So now we're to the point where it's time to get ourselves as leaders as well as our staff more involved in the community and really start to be part of the community more so than it probably has in 10 or 15 years, right? So a little bit about Abrazo, or Abrazo Central. We are part of Tenet Healthcare. People probably don't realize that because we don't brand Tenet Healthcare. Tenet Healthcare is the second largest health system in the country. Okay, people don't realize how big Abrazo is as it relates to our parent company. We have 80 hospitals across the country, everywhere from Arizona and California, which is the Abrazo system, which is us. We're part of what's called the West Region, which is all of California and Arizona. So all of our leadership gets together every week. We get together through video and phone, but we get together with all the California hospitals, and all of our California and Arizona leadership all get together every week and talk about, hey, what are we doing in the community? What are we doing from a technology standpoint? What are we doing to improve quality of care, patient safety, things like that? So we share these ideas every week, okay? And then as you can see, it goes all the way across to the Eastern Seaboard. So we have a lot of best practices that we put into place at our hospital that we garner from other hospitals across the country. We also own several different health plans. We own one here in Phoenix, Phoenix Health Plan, or PHP. Some of you may or may not be aware that we actually own that health plan. And then we also own Tenet just purchased USPI, which you guys don't probably care who USPI is, but USPI is the world's largest owner-operator of surgery centers. So there are 16 here in the valley that USPI is owner of, and therefore now we're now owners as well. These are all, I know this is hard to see, and don't worry about all the naming and all that kind of stuff, but wanted to give you just sort of a snapshot on how big Abrazo really is across Phoenix. Okay, you guys have Abrazo Central right here in your neighborhood, but Abrazo itself, the health system, Abrazo Community Health Network, spans the entire valley. People don't realize how big we really are and how important we really are to the community of Phoenix itself. So we have 6 hospitals. Abrazo Central, which historically was Phoenix Baptist. We have Arizona Heart Hospital. We have Arrowhead Hospital, Maryvale Hospital, West Valley Hospital, and what used to be called Paradise Valley Hospital, which is now called Abrazo Scottsdale. So all of those hospitals, all part of Abrazo Community Health Network. We also have a network of roughly 10, I think actually since this slide was done, we've got 2 more, so I think we're at 12 different family practice clinics across the valley. We have 1 here at Abrazo Central in our medical office building. We also have this says, I think this says 6 or 5. We actually have 8 now freestanding emergency departments throughout the valley as well. We have 2 out in West Valley. We're opening 1 in the East Valley as well in the next 2 to 3 months. So just wanted to give you an idea of how big Abrazo Central is or Abrazo Community Health Network is to the valley. Abrazo Central, you guys have a gem right here in your community that probably a lot of you, unless you've been there or worked there, you probably don't realize what you guys have. So I wanted to just give you some quick statistics. As you know, it's a very historied hospital. We've been here since 1961. We have 221 licensed beds, which doesn't probably mean a lot to you other than the fact that we're the 3rd largest in Abrazo. And we are one of the larger hospitals outside of St. Joe and Good Sam in the valley.
What kind of census do you use? Or
Do we have?
run?
Right now we have 221 beds. Not all of those beds they're all licensed. Not all of those beds are staffed at this point. But right now, our average daily census is running a little over 100. So we, depending on the time of year, wintertime we tend to flex up. We tend to be more busy with some of the snowbirds coming in. So we'll get busier in the winter months. We have 910 employees at this point in time, and just over 800 affiliated physicians on staff at the hospital, which is a lot of physicians. So we have a lot of physicians that come to this hospital, whether they be out in Scottsdale or they be in the West Valley. They are on staff at the hospital and they provide services. So it's a good number, and we have another 50 volunteers that come every day and do everything from greet patients when they walk through the doors to put on various community events and activities for the hospital. We care for, or we admit and discharge just under 9,000 patients a year, which is the 2nd most in the Abrazo system. We have 56,000 ER visits, which is, believe it or not, the busiest non-trauma ER in all of Phoenix. So we are not a trauma center. You think of St. Joe, that's a level 1 trauma center. We are the busiest non-trauma emergency room in all of Phoenix. People don't realize that. We are busy. We are very busy. And I'll tell you something here in a second that people can't appreciate either here in a second. We do just short of 2,300 and just short of 3,000 total or inpatient and outpatient surgeries every year. As you guys know, as healthcare changes, the number of inpatient surgeries are changing a little bit. It's more and more surgeries are being done in the outpatient setting. Hence the acquisition of Tenet by USPI to buy surgery centers, because more and more of that business is transitioning to the outpatient setting. So just a little bit, you'll notice, you guys have probably noticed our postage stamp signs. That's what people call them at the hospital. The new postage stamps. It's the new sign. It's the temporary signage that's up on the hospital. With the new brand and the new logo. We're actually getting ready. We're getting ready to mount all new signage on this permanent signage on the side of the hospital. So it's quite an undertaking to change out signs and logos, and when you change your logo, how many signs you actually have to change. It's pretty intense. And then here you can just see, you know, some of the core services that we provide, everywhere from, you know, obviously emergency medicine to heart and vascular, all the way down. We do wound. We have a dedicated comprehensive wound care center. We just invested in and opened a 16-bed, what we call acute rehab unit or an inpatient rehab, that's designed for the treatment of acute stroke patients that have had a stroke, need inpatient rehabilitation services, come through our rehab unit. And we get rehab patients, believe it or not, everywhere from New Mexico to California. We've had them from all over the place. Couple of things I want to go through, just a few slides here. I'm going to keep it really brief, but some things that people probably don't know about Abrazo Central. We are an accredited hospital by the Joint Commission, which is the biggest and most important accrediting body of any accrediting body in the healthcare world. Two things that are very important to us and that we're very proud of is, one, our Get With the Guidelines Stroke Gold Plus Quality Award and our Primary Stroke Center designation. Those two things have been a long road for this hospital to get to, and it's they're two very prestigious awards or designations from a neuroscience perspective. We're the only system in Phoenix right now that all of our hospitals are primary stroke certified, and we have our comprehensive stroke certification that'll come up in early 2016, and once we get that designation, we'll be the only Abrazo Central will be the only hospital in Arizona to be comprehensive stroke certified, which means we have the highest quality and most highest technology to care for stroke patients. So people don't get that. Yeah.
Are you moving towards becoming a magnet hospital?
Yes, we're moving in that direction. You'll find that, you know, I think any hospital is moving in that direction. That's just from a nursing perspective, from an educational perspective, that's what everybody's striving for. So absolutely, yes, we have some.
What do we mean by a magnet hospital?
So magnet status is a nursing status that's based on education. You've got the right nursing staff trained to do the right services. So a neuroscience nurse is trained to provide nursing services, and so instead of just training all nurses to do everything, they're trained to do specific duties. So
It's kind of past some of the things it does.
yeah. And then obviously, you know, a couple other things here. We're a top 50 cardiovascular hospital by Truven Healthcare, which is a large organization that rates hospitals based on different quality metrics. And then we are an accredited chest pain center by the Society of Cardiovascular Patient Care, which means our emergency department has protocols and policies put into place to treat chest pain patients when they come through the ER. You know, so basically we're providing the highest quality of care that we can possibly provide, and that organization has said we agree that you are hitting those metrics and you are working through those protocols to provide that level of care. We are, like I said a minute ago, we are the busiest, one of the busiest. Actually, now we are the busiest based on recent numbers. Non-trauma emergency room in the Valley or in Phoenix. We see more than 7,200 non-trauma related ambulance visits. Believe it or not, that is the most. We are the highest volume emergency room for Phoenix Fire for non-trauma related accidents. So we're seeing more ambulance visits to our ER than anybody else in Phoenix for non-trauma related care. We're also one of the few hospitals in Phoenix that is a certified pediatric receiving emergency room, which means that we have again the training and the protocols and policies set in place. When a pediatric patient or a child comes through the ER, we are set up to treat that patient. Now, we are not a children's hospital, So what that means is we treat the patient, we triage the patient, and we have protocols in place to immediately transfer that patient to Phoenix Children's or whatever the local children's hospital may be that we end up transferring to. But we are we are one of the few receiving hospitals that can take pediatric patients and treat them and triage them and get them to the right level of care. So we are busy. However, did you know that we only have our average time from the time you walk through the door to the time you see a provider is 17 minutes, which is fast. It ranges in a lot of ERs. It ranges maybe from an hour to 2 hours. We're 17 minutes. We have gone through many process improvement initiatives to make sure that happens. In fact, we also have now the availability that if you need to go to the ER, you can go online to our website and schedule an appointment in our ER. Okay, people don't do that, right? Other hospitals don't do that. It's fantastic, right? Whoever thought that you could schedule an appointment to go to the ER? So if you go onto our website, you can either go to the link here, or you go to abrazohealth.com and you can click on the logo there, the ER check-in. It's pretty fascinating. We get roughly 100 people a month that will check in online. So it's fascinating to watch. So the biggest thing that Abrazo Central has done is we have become a central hub for neurosciences within Abrazo Community Health Network. And what that means is we have developed a neuroscience program at Abrazo Central that welcomes all of the other neuroscience patients at all of our Abrazo hospitals. So anytime, if you have a stroke and you go to Arrowhead, and you end up in Arrowhead's ER, more than likely you're going to be transferred to Abrazo Central, where we have the capabilities through what's called an endovascular biplane unit, which is some of the highest state-of-the-art technology in all of the country for the treatment of stroke patients. Okay, you're most likely going to be transferred to Abrazo Central to have what's called an intervention or a coiling or a clipping of that aneurysm, okay, which is causing your stroke. We have the highest level of biplane in all of Phoenix. We've invested heavily in our neuroscience program. And that's why we've been able to gain the recognition and the accreditations that we've been able to garner for neurosciences. We do have a dedicated team everywhere from neurologists and neurosurgeons to our neuroradiologists, and then all of our nursing staff is neuroscience trained. So it kind of gets you to the magnet status, starts to get you to the magnet status. We also have a procedure. It's called the NICO brain path, which is absolutely fascinating. And if you're ever want to go on YouTube and type in Dr. Marco Marcella, he's been on all the local news channels have all done stories on him over the last 6 months. He does a procedure called the NICO brain path, which is essentially a GPS guided, non-invasive, meaning does not does not fully cut into your skull, to do a deep brain tumor removal. Okay, so he does it with doing just 2 small holes, GPS guided, does not interfere with the brain matter. Our first patient came through earlier this year, went through the NICO, was told by another neurosurgeon in Phoenix that it's a non-operable brain tumor and there's nothing they can do for him. Got a second opinion by Dr. Marcella. Dr. Marcella provided the surgery 24 hours later. 48 hours after that, he went home. Wow. So it's pretty phenomenal stuff. We're the only hospital in Arizona to provide that service, and Dr. Marcella is one of only 120 neurosurgeons in all of the country that can do this. So something that is not offered everywhere. Okay, it's pretty phenomenal stuff. We are a teaching hospital. We have a residency program, family medicine residency program. It's one of the oldest family medicine residency programs in Phoenix. It's been around since 1978. We have 21 residents throughout 3 years, so we have 7 residents per year. And our goal, which has not always been the goal, but our goal is to make sure that when they graduate, they provide care in this community. All right, so our goal is to keep those residents in this community, not in Phoenix, but in this community right here. So we are working with Tenet and with our physician group at Abrazo to make sure that we are either opening new practices or we are filling practices that are already in the community with the residents that we're training. They're already here, they know the patients, they know the community, so why not keep them here? Because you may or may not know, Central Phoenix has a shortage of primary care physicians, and so we're working diligently to try to close that gap. And by using our residents, we can do that. We also have a family medicine clinic on campus, which is a family medicine practice. It is staffed by our residency faculty as well as our 21 residents. And we see out of that practice, we see about 16,000 patients every year. We have the capacity and capabilities to see closer to 20,000. So if you're ever in need of a primary care physician, our family medicine clinic right here on campus is open for new patients. And then just one last slide, two things. There are two accrediting bodies that everybody kind of in healthcare kind of looks to from a quality perspective. One is what's called Health Grades, and the other one is Leapfrog. If any of you subscribe to the Phoenix Business Journal, there was an article today that said, "Which hospitals in Phoenix will not kill you?" Okay, love the headline, right? Health Grades was the reporting organization in that article that rated the hospitals in the Valley. We were rated #1 for heart care. Okay, so meaning we will not kill you. Okay, I just want to be clear. So we were rated the highest for quality, for our quality scores of anybody. And then finally, just in the last couple of weeks, we've been rated by Leapfrog Group, which is a large national quality accrediting body. We were just given an A grade, which they give out very few A grades across the country. Abrazo Central was given an A grade. So high quality, high technology. We've transformed this hospital a lot in 2 years, and now it's time for us to get more and more involved in the community and share with you guys what we have to offer. So that's why we're here.